Loop diuretics are a class of diuretics represented here as the loop-Henle di-rocket. These drugs inhibit the ion transport in the thick ascending limb of the loop of Henle. The thick ascending limb of the loop of Henle. These drugs inhibit the sodium-potassium chloride channel, which normally resorbs these ions, represented by the inhibiting chains on the salt shaker banana and chlorine dispenser wearing a 2-2-2. Loop diuretics are sulfa drugs, shown by the sulfur match. A commonly used loop diuretic is furosemide, the fir rose, which is also called Lasix, the laser. A serious adverse effect is ototoxicity from rapid injection, which is portrayed by the ears with a toxic green glow from the fast syringe. This drug can cause adverse effects, such as gout, the goat, due to hyperuricemia. Other adverse effects include dehydration, the empty canteen, hypocalcemia, the hypocalcified cow, and hypokalemia, or decreased level of potassium, represented by the hippo banana. Finally, patients may suffer from orthostatic hypotension, the hippo BP. To summarize, loop diuretics work in the thick ascending limb of the loop of Henle and inhibits resorption through the sodium-potassium chloride channel. These are sulfa drugs which have the name furosemide or Lasix. Side effects include ototoxicity from rapid injection, gout precipitation, dehydration, hypocalcemia, hypokalemia, and orthostatic hypotension.
Loop diuretics work kind of like a loop hen riding a di-rocket to escape the farm. Guess she doesn't care for being cooped up in the thick ascending limb of the loop of Henle, so she makes a break for freedom. But she'll need supplies for her journey, so she slaps some inhibiting chains on all the salt shakers, bananas, and chlorine dispensers and tutus she can find, and blasts off from the loop of Henle with each in tow. She even packs along some sulfur matches for building campfires on the cold nights that surely lay ahead. The other farm animals see this as their chance to escape too, but the farmer set up a fir rose with a laser to keep them all in check. As the loop hen lifts off, the laser fires a fast syringe, causing a toxic green slime to ooze from the ears of a poor little goat. And the farm's prized hippo cow is blocked from escaping when the laser burns a hole clean through its canteen and empties it. Without a water supply, she'd never make it on the outside. She might even be driven to a point of desperation, where she might even consider eating her best friend, the hippo banana. She clutches her best friend for a moment and weighs her options, but stays at the farm in the end. In all the commotion, with fluid spraying every which way from the loop of Henle, the hippo paddles away in the flowing stream of urine.
In this picmonic, we depict loop diuretics as the loop hen on di-rocket and describe what educational foundations should be taught. Furosemide, also known as Lasix, shown by the fir rose with laser, is the most commonly used diuretic. Typically, loop diuretics are used for patients that have heart failure, the dead heart, pulmonary edema, lungs with edamame, and or acute renal failure, or ARF, shown as the acute angle kidney dead. Diuretics help to eliminate edema, shown by the running edamame, which is excess fluid that is retained in the interstitial space and around organs. When patients are on Lasix, the provider needs to be aware of any electrolyte imbalance. The provider should be notified of weakness, dizziness, and muscle cramping, which are a few signs and symptoms of an imbalance, and are depicted in this picmonic by the doctor notified of weak, droopy muscles, dizzy eyes, and muscle clamp. Educating the patient to increase their potassium intake, the up arrow banana, as well as check their blood pressure daily, the daily BP, along with their daily weights and I&Os, the daily weights on the I&O scale, can help the provider to manage proper dosages. In summary, loop diuretic education begins with understanding furosemide, or Lasix, which can be used for patients with heart failure, pulmonary edema, acute renal failure, or edema. It is important to notify the provider of any changes in the patient's status, such as weakness, dizziness or cramping, educate the patient to consume more potassium, and monitor BP, weight, and I&Os daily.
Ever wonder what doctors do when they're not caring for patients? They watch action flicks, of course. Right now, this doc is getting his kicks by watching one about the loop hen saving the world in her die rocket, where foul play meets with foul kind. Or should I say fur kind, as her trusty sidekick is the fur rose. Together with his laser, the hen and the rose save the day from an evil force destroying this town and killing heart homes. It was an invasion of edamame that came down for a long takeover, and they taken out the kidney with an acute angle. Then, our furry and feathery heroes shoot these edamame down.
Excuse me, Doctor. Sorry to interrupt your movie time, but I need to notify you of some weak drooping muscles, muscle clamps, and dizzy eyes. Yes, of course. Looks like you need a rocket-launched banana up in your face. Sorry, I gotta stop watching action flicks. Make sure we keep an eye on that daily blood pressure and keep up the good work with the I&O scale with daily weights. And good day to you.
Remember hydrochlorothiazide, one of the most commonly used thiazide diuretics, by the hydrant chlorine tarzan. This drug works by inhibiting reabsorption of sodium chloride and water in the early segment of the distal convoluted tubule, shown by tarzan swinging on the inhibiting chains which are pulling the salt shaker and water bottle from the sponge. This drug is used to treat edema, shown by the edamame, and mild to moderate hypertension, the mild to moderate hyper BP. Be sure to educate the patient on possible side effects such as hypokalemia, shown by the hippo banana, hyponatremia, the hippo salt shaker, and dehydration, the empty canteen. Because thiazide medications can elevate plasma glucose, it is also possible to experience hyperglycemia, shown by the hyperglue bottle, as well as gout, shown by the goat, due to various elevations of compounds in the blood. Contraindications for this medication include a sulfa allergy, the sulfur match allergy alligator, and those who are pregnant or breastfeeding, shown by the pregnant and breastfeeding alligator. So in summary, hydrochlorothiazide works by inhibiting reabsorption of sodium chloride and water and is used for the treatment of edema or mild to moderate hypertension. Side effects may include hypokalemia, hyponatremia, dehydration, hyperglycemia, and gout. Do not give to patients with a sulfa allergy and those who are pregnant or breastfeeding.
Hydrochlorothiazide can be pictured as a hydrant with a chlorine dispenser, and Tarzan is swinging to open its valve and fill a pool with chlorinated water. Remember hydrant chlorine Tarzan as swinging on a chain, and the other end is attached to a salt shaker, and it's being pulled away from its absorbing sponge. And the salt shaker is dragging a water bottle along with it, because HCTZ inhibits the reabsorption of sodium chloride and water. The hydrant is sucking water away from the local area to fill a pool, where the neighborhood edamame are doing cannonballs and splashing a hiker BP, who's bobbing around on his inflated blood pressure cuff, as the pool is filled between mild and moderate levels. There are many side effects from the hydrant sucking away all the neighborhood's water, though. The nearby river goes dry, and a hippo banana fights with a hippo salt shaker over the last drop of water from an empty canteen. A naturalist hiker glue bottle tries to do something about the dry riverbed by filling it with his own glue, with a little assistance from his pet goat. The other neighbors that everyone is cautionary around are the alligators. The dad lights his barbecue with a sulfur match, inviting everyone over, like they're the main dish, while his pregnant alligator wife breastfeeds their little one beside him.
Remember spironolactone, also known as trade name aldactone, by the spiral of Milk Tower, where the ruler of the city sits upon and orders his milk minions around. Spironolactone works by inhibiting the action of aldosterone, shown by the inhibiting chains on aldostereo. Aldosterone is responsible for sodium and water retention and potassium excretion. Therefore, by blocking its effects, spironolactone increases sodium excretion and potassium retention, shown by bananas retained in jail. Spironolactone is commonly used in conjunction with a loop or thiazide diuretic to treat hypertension, shown by the hiker BP between blocks being watched until his blood pressure lowers. When combined with diuretics, this drug can also be used to treat edema, shown by the edamame. Additionally, spironolactone is often utilized in the management of heart failure patients, represented by the dead heart, due to the properties of blocking aldosterone receptors in the heart and blood vessels, along with decreasing fluid and retaining potassium. This retention of potassium can lead to the side effect of hyperkalemia, shown by the hiker banana. Spironolactone not only binds to mineralocorticoid receptors, but inhibits androgen receptors as well, leading to endocrine effects, shown by the endocrine glands. In men, this anti-androgen activity can lead to gynecomastia and erectile dysfunction, while in women it can cause irregular menses. Lastly, because spironolactone increases potassium reabsorption, patients should avoid any additional potassium supplements, shown by the avoid sign next to the banana pills. So, in short, spironolactone works by inhibiting the action of aldosterone, which increases potassium retention. It is indicated for use in treating hypertension, edema, and heart failure. Possible side effects include hyperkalemia and endocrine effects. Be sure to educate that patients should avoid potassium supplements.
The spiral of milk is like the Tower of London. It's where criminals are taken to be jailed and tortured. It's common to find Aldo chained to the wall for playing his stereo too loud. But the jail is mostly filled with bananas, doing hard time for making phallic references. Over in the torture room is where things get really interesting. The spiral of milk minions are ruthless when dealing out punishment. They pump hiker BPs between blocks so they can't expand, until the pressure is too much to take, and finally, edamame begged to be boiled after being waterboarded in fluid day after day. And as you can see by the dead heart, death is the only way that the milk spiral minions let you leave. But after decades of putting up with the ruthless tower of torture and watching so many bananas locked up, never to be seen again, the people have decided to revolt, led by their inspiring commander, Hiker Banana. He's assembled an endocrine gland army, and if there's one army you don't want to mess with, it's one that's all hopped up on adrenaline and testosterone. The pancreas is used like a medieval catapult and launches banana pills, which are avoided at all costs within the spiral of milk, as they're highly explosive and a danger to all spiral of milk minions. Let the bananas rejoice.
Remember mannitol, also known by its trade name osmitrol, by the manatee attempting to escape the theme park using a dye rocket. This medication works as an osmotic diuretic, shown by the water dye rocket strapped to his back. This means that it functions by creating an osmotic force within the nephron that inhibits the reabsorption of water, thus increasing diuresis. It is indicated for use in reducing intracranial pressure, shown by the down arrow cranial pressure cooker, as it pulls excessive fluid out of the cerebral tissue. It can also be used to reduce intraocular pressure, shown by the down arrow draining eyes. Furthermore, mannitol is sometimes used for renal failure prophylaxis, shown by the dead kidney with purple axis, as it prevents renal failure by preserving urine flow. Mannitol is able to pass freely through the capillaries within the body, causing water to follow. This mechanism can result in increased fluid buildup, leading to edema, shown by the edamame who think this escape is just part of the show. Another side effect is fluid and electrolyte imbalance, represented by the fluid and electric lights unbalanced on the scale. This is because as rapid fluid excretion occurs, the concentration of electrolytes in the body may increase. It is also important to note that the patient with cardiac issues is at risk for the development of congestive heart failure, because mannitol is capable of leaving the capillaries and pulling water with it. Therefore, avoid use in cardiac patients, shown by the avoid sign next to the heart. Lastly, give this drug via IV administration, shown by the IV bag. Carefully inspect the infusion to check for crystal precipitate and administer at a rate to promote a urine output between 30 and 50 milliliters per hour. Diuresis should begin within 30 to 60 minutes and last for 6 to 8 hours. So in short, mannitol works as an osmotic diuretic, thus it is useful in reducing intracranial pressure and intraocular pressure, as well as for use in renal failure prophylaxis. Side effects include edema and fluid and electrolyte imbalances. Avoid using the drug in cardiac patients and give it via IV administration.
This manatee saw Free Willy and decided that it too could escape from SeaWorld. But he knew he had zero chance of jumping high enough to clear the barrier. That's why he strapped on a water dye rocket and blasted off. His favorite trainer bowed his neck back as the manatee flew overhead, and fluid drained from his pressure cooker cranium. Joyous tears drained down from his eyes, and his kidney, who had insisted the park be closed and was nearly beaten to death for saying so, was saved when the giant manatee blocked out the sun and sent the Purple Axe perpetrators running. The edamame thought it was just another SeaWorld performance and stood in their bleachers, waiting to be splashed. And they were. Fluid went spraying everywhere when the manatee landed. So much, in fact, the fluids and electric lights of the park became unbalanced, and electric lights were launched into the sky, exploding like fireworks. It was the single most epic show SeaWorld had ever had. The only one who didn't like it was the heart, because it couldn't swim, and it ran for the stairs to avoid the flowing torrent of fluid. Sadly, the manatee had not escaped. Instead of landing in the open ocean, he had simply landed on an IV bag in the adjacent tank. But SeaWorld loved it, so the manatee was made to repeat the stunt on a daily basis, and they made lots of money. The end.
In this picmonic, we discuss commonly used medications for the treatment of primary hypertension, which can be remembered by the story of hiker BP with medications getting captured for failing to make any lifestyle changes. Diuretics, illustrated by the dye rocket, are used to lower blood pressure by reducing circulating fluid volume. Angiotensin-converting enzyme inhibitors, or ACE inhibitors, depicted by the ACE with inhibiting chains, primarily work by lowering the amount of angiotensin II in the body. Angiotensin II receptor blockers, or ARBs, are represented by the angel tennis player in 222 with receptor blocked. This class of antihypertensive medications prevents angiotensin II from attaching to the AT1 receptor. Another pharmacological intervention is the use of beta blockers, as depicted by beta fish with blocks, which inhibit sympathetic nerve impulses in the heart and subsequently decrease heart rate. The last group of medications we will talk about are dihydropyridine calcium channel blockers, the dihydropyrimide calcium cow channel with blocks, which work by relaxing the vascular smooth muscle and lowering peripheral vascular resistance. In summary, remember that diuretics, ACE inhibitors, ARBs, beta blockers, and dihydropyridine calcium channel blockers all work to lower blood pressure and treat hypertension. So to summarize, antihypertensive medications combined with dietary and lifestyle changes are the mainstay of treatment for people with primary hypertension. There are a variety of antihypertensive medications that can be used, including diuretics, angiotensin-converting enzyme or ACE inhibitors, angiotensin II receptor blockers or ARBs, beta blockers, and calcium channel blockers, or CCBs.
After refusing to make lifestyle changes at his high blood pressure intervention, the hiker BP has been cheating fate by relying on medications, but he's borrowed enough time, and destiny is finally here to collect. Literally, the fate and chance police are here to arrest him and force him to change his ways. He doesn't realize he's stumbled into a trap until it's too late. First, the dye rocket rolls the dice and launches into the air. That's the signal that the hiker has arrived. Immediately, the ace binds him with inhibiting chains, restricting his movement without constricting. Then, the block team gets to work, building a wall to block him from escaping. You can bet on the angel tennis player in a 222 who volleys blocks into place with her receptor like a pro. Next, the lucky beta fish piles blocks as fast as he can. At the end of the line, the hiker's ultimate fate awaits. A dice pyramid guarded by the Hydra, who's offering no more second chances. As the forces of chance seal the hiker away, the calcium cow blocks all remaining channels for escape. Fate caught up with this hiker in the end, and now he'll have to change his ways.
Remember angiotensin-converting enzyme inhibitors by the ACE inhibitor breaking up this illegal poker game. This class of medication is easily remembered by the pril suffix, shown here by the pile of pearls as a prize. ACE inhibitors work by blocking the renin-angiotensin-aldosterone system, or RAS, depicted as blocking raspberries with wrench, angel tennis, and aldosterone. Common indications for this medication include hypertension, the Hiker BP, and heart failure, the dead heart. Side effects may include a dry, non-productive cough, the dry and non-productive coughing coffee, hypotension, the hypo BP, and dizziness, the dizzy eyes. Aldosterone aids in the reabsorption of sodium and water in the kidneys and normally exchanges them for potassium. Inhibiting aldosterone with this drug class can cause increased potassium retention, leading to possible hyperkalemia, shown by the Hiker banana. While rare, angioedema, the angel edamame, may also occur and is more common in African Americans. With ACE inhibitors, it is important to educate patients to slowly change position, shown by the slow tortoise getting up from the delta chair, as orthostatic hypotension may occur. Lastly, do not abruptly stop taking this medication, the can't stop cold turkey, as a rebound effect can occur causing a hypertensive emergency. So let's review ACE inhibitors, remembered by the pril suffix, which work by blocking renin-angiotensin-aldosterone system. They may be used for treating hypertension and heart failure. Common side effects include a dry, non-productive cough, hypotension, dizziness, possible hyperkalemia, and angioedema. Remember to educate the patient to slowly change position and do not abruptly stop taking this medication.
This ACE inhibitor is like an agent from the Gaming Commission, and it's breaking up this illegal poker game. The prize pot is a string of valuable pearls, and instead of poker chips, these players use raspberries. So the ACE inhibitor slams a block on the berries. It cuffs the Hiker BP right as he wins it all, because high-stakes poker games are making his blood pressure just as high. And the heart lost everything, dying right at the poker table. And dead hearts is something the ACE inhibitor can't allow. As a side effect of this agent breaking up the game, everyone watching tried to make for the door before they were arrested. The dry coffee gave a little non-productive cough and elbowed his friend to let him know it was time to go. But the Hippo BP was entranced. A spinning raspberry poker chip on the table was giving him dizzy eyes. It was all part of the Hiker Banana's distraction, so he could make off with the pearls when no one was looking. But an angel edamame server wasn't having it, though she did offer him some edamame in the place of pearls. A slow tortoise rose from its delta chair, hoping to go unnoticed. And not to become the victim of another gambling intervention, a cold turkey broke for the exit and couldn't be stopped.
Remember angiotensin II receptor blockers by the angel tennis players in tutus locked in an epic game of tennis against blocky Spartans. This class of medication ends in the suffix sartan, shown by the Spartans in the game blocking any plays the angel tennis players in tutus make, representing this drug's mechanism of action, which is to block angiotensin II receptors. They are commonly given for treatment of hypertension, shown by the Hiker BP chair umpire falling from its seat. But certain varieties of ARBs may also be used for treatment of heart failure, diabetic nephropathy, stroke prevention, or migraine prophylaxis. A side effect to be aware of is angioedema, shown by the angel edamame, who has taken on a new life at the match. Be sure to remember that this medication is contraindicated in patients with renal artery stenosis, the kidney arteries made of stone, and in pregnancy, shown by the pregnant woman behind the caution tape, who is watching this exciting match. So in summary, angiotensin II receptor blockers are also known as ARBs and are drugs ending in sartan. They work by blocking angiotensin II receptors to treat hypertension. They can lead to angioedema and should not be used in pregnant women due to birth defects, nor in patients with renal artery stenosis.
For those of you just tuning in, welcome to the Wimbledon Final. It's a beautiful day for tennis, and I can say with confidence that we are all of us in for a treat. The Angel Tennis duo is stepping onto the court, brandishing the latest model of receptor racket. And here comes the challengers, the ever-relentless Spartans. Oh! Yes, indeed, their chant never fails to make an impression. And they're getting right to it, hurling blocks at the Angel Tennis duo without delay. Oh my! What an impressive display of athleticism! as one angel catches a block on her receptor and deflects yet another.
Oh my! The Hiker BP line judge has just been caught in the crossfire.
And one unlucky fan is experiencing the side effects of sitting courtside. Will everyone please stand in a moment of silence for the dearly departed Angel Edamame as she ascends to heaven? Now, back to tennis! Unless, of course, you're a kidney with arteries of stone. Or pregnant. Our turnstiles have been specifically designed to prevent your entry. We can't have stray blocks reducing the kidney's blood flow any further. And we absolutely cannot have pregnant women ending up like the Angel Edamame. Why, the press would have a field day! And we simply can't risk tarnishing the sterling reputation of the sport we love so much now, can we?
Remember calcium channel blockers, such as verapamil and diltiazem, by the calcium cows in their channel being blocked by V-Rapper with a dil taser. These drugs slow AV conduction in the heart, which is why they're clearing the tracks for the slowed aviator snail conductor. Remember that because this drug slows conduction, it should not be given to patients with pre-existing heart blocks. These drugs are used for angina pectoris, the angel with pectorals, as they reduce the heart's oxygen demand. Due to their effect on the AV node, verapamil and diltiazem can be used to treat arrhythmias, the broken arrhythmia drum. These drugs may also be used in the treatment of essential hypertension, the espresso Hiker BP. While it is not a first-line treatment, these drugs have been shown to help a subset of patients. These drugs have side effects which include bradycardia, the snail heart wife of the conductor, as well as hypotension, the hippo-BP that she has been seeing while the conductors have been away. Constipation can also occur from the calcium channel blockade, the corked con toilet, as well as peripheral edema, the peripheral edamame upstairs who is playing with the gums and teeth wind-up toy, which represents the side effect of gingival hyperplasia. Finally, patients should be given thorough medication education, the medication educator explaining the consequences of this drug class. So, in short, calcium channel blockers include verapamil and diltiazem and work to slow AV conduction in the heart. They can be used for angina pectoris arrhythmias and essential hypertension. Side effects include bradycardia, hypotension, constipation, peripheral edema, and gingival hyperplasia. Make sure to provide medication education to patients.
The calcium cows are having their channel blocked by the V-Rapper using his dil taser. He prods them in the rear, moving them out of the way so that the slowed aviator snail conductor can make his glorious return home after a cross-country railroad trip. In the back of his train, he's harboring a few stowaways. The angel with pectora, whose glorious pecs were making the arrhythmia drum heart beat wildly. So much so that he nearly knocked the espresso out of Hiker BP's hand. This snail conductor is excited to finally see his wife, the snail heart, after a long time apart. But what he doesn't know is that she's been seeing another man, the hippo BP. She needed some consolation after she was left by herself, and her son, the peripheral edamame, wouldn't spend time with her because he was always locked up in the bathroom, sitting on the corked con toilet, playing with his gums and teeth wind-up toy. So in one fell swoop, this poor conductor's snail's life was torn apart, and his only remaining friend, the medication educator, stood there preaching, "I told you so, buddy. Bros before, well, you know. Otherwise, you'll end up with a broken snail heart."
Clonidine is a sympatholytic medication shown here by the clown dining at a restaurant, then whipping it into shape. Clonidine works as an alpha-2 adrenergic receptor agonist, the Afro-2-2-2 dragonist, leading to decreased sympathetic outflow from the central nervous system. This reduces norepinephrine release systemically and also affects cognitive function via the prefrontal cortex. Because clonidine reduces sympathetic tone, it is used to decrease the blood pressure of patients with hypertensive urgency. the hiker BP and urgent alarm. Clonidin's inhibitory effects on the prefrontal cortex allow it to be used for some patients with attention deficit hyperactivity disorder, ADHD, the ad head with ADHD. Similarly, clonidine can sometimes be used to treat Tourette syndrome, the torn rat, which is characterized by motor and vocal tics. Clonidine can also help reduce signs and symptoms of opioid withdrawal, like sweating and agitation, shown by the poppy droid making a withdrawal. Side effects include CNS depression, the deflated CNS brain, with sedation or confusion. Respiratory depression can occur especially with clonidine overdose, represented as the deflated lungs. Hypotension, the hypo-BP, can also occur from clonidine's sympatholytic effects. It must be tapered slowly because rebound hypertension can occur if clonidine is abruptly stopped, shown by the rebounding hiker BP if stopped cold turkey. So in summary, clonidine is an alpha-2 agonist that reduces sympathetic tone. It can help manage hypertensive urgency, ADHD, Tourette syndrome, and opioid withdrawal. Side effects include CNS depression, respiratory depression, and hypotension. Lastly, it can cause rebound hypertension if it is abruptly discontinued.
I'm Clown Dine, and tonight we dine in hell. Or at least it seems like hell. What did you boil this wiener in? A laughing stock? Look, I'll help you out as a nice jester. What's not so nice, though, is my Afro tutu-wearing dragonist. He'll bite you if you don't whip this place into shape. And that's probably better than biting the food in this place. Honestly, seriously, what's in this? I'm feeling funny. Now I'm invited to address the restaurant owner, who is clearly a hiker BP in a crisis. I want you to sound the urgent alarm because we're going to retrain your entire staff. Like your ad head busboy with ADHD. He can't focus on his job. I'm all about funny business, but you need to pay attention. Next, let's address your unsanitary pest problem. That's right, I'll rid this place of torn rats in no time. Finally, we need to take care of your terrible spending problem. Once we get your budget into shape, your poppy droid accountant won't need to make all those withdrawals. I know a thing or two about money budgeting. My uncle is Pennywise, you know. Yeah. It's not gonna be easy. I know I'm not for everyone. All this actual effort may make your waiter's brain deflate a bit, but hey, it's not my fault he was such an airhead. Come on, I've heard of being worked out of breath, but don't deflate your lungs. And hey, with your restaurant doing so well, you might slow down BP. So much so, you might become Hippo BP. Lastly, I know things are running smoothly now, but I can't leave just yet. Because I know if I leave abruptly that Hiker BP will rebound to his old ways and just start serving cold turkey. This is no laughing matter. You know, being the Clowndine is like my shoes. No small feat.
Remember Prazosin as Poseidon, god of the ocean, and his friends trying to stop pollution. Drugs in this class typically end in the osin suffix, the ocean Poseidon is trying to protect. Prazosin is also known by its trade name, Minipress. It works as a selective alpha-1 receptor blocker shown by the Afro-1 wand receptor block guy. While not a first-line choice, Prazosin can be used to treat hypertension shown by the Hiker BP. It can also be useful in treating urinary hesitancy associated with benign prostatic hyperplasia, BPH, the bunny plum in a hiker with plates. Though not very common, prazosin can be used in low doses to prevent nightmares, the nightmare. Other indications include post-traumatic stress disorder, PTSD, and Raynaud's phenomenon. Side effects of this medication may include orthostatic hypotension, shown by the oar in the hand of the hippo BP trying to row away, but something is caught on his tack-heart card boat, representing tachycardia as another side effect. These can present as syncope. Generalized effects on sexual function can occur, as prazosin can cause priapism or inhibition of ejaculation, seen as the man pitching a tent. Another side effect is nasal congestion, shown as the stuffed nose congested and full of tissues. It is also important to be aware of a phenomenon known as first dose effect, shown by the first place ribbon dose, which describes how side effects like orthostatic hypotension and fainting are generally seen after the first dose. This medication should be given at bedtime, shown by Poseidon taking the medication in bed, due to its syncope risk. So in summary, prazosin belongs to a class of medications that typically end in the osin suffix. It is a selective alpha-1 receptor blocker indicated for use in the treatment of hypertension, BPH, and nightmares. Side effects experienced may include orthostatic hypotension, tachycardia, priapism or inhibition of ejaculation, and nasal congestion. Be aware of the first dose effect and be sure to advise that the medication should be given at bedtime to prevent significant side effects.
To remember prazosin, think of an angry Poseidon, the god of the ocean. He and his friend, Afro 1-1 receptor block guy, have had enough of people polluting and destroying his beloved ocean. So with their powers combined, Poseidon and Block Guy were able to use the waters as their weapon and created a massive tidal wave that engulfed local hikers like hiker BP. BP wasn't the only hiker affected. As the waves crashed the beach again and again, it started local wildlife too, like Bunny Plum, who hit hiker plates right in the gonads. They tried to get away from Poseidon's fury on a nightmare, but they couldn't escape from the destruction. The effects of Poseidon's tsunami also hurt other water creatures, like oar hippo BP, who frantically tried to row away, but something was caught on his tack-heart card boat. It was a pitched tent from a camper on the beach. The waves soaked his tent and gave him quite a stuffy nose. Needless to say, these beachgoers left to never return again. Poseidon had finally won the battle, and he celebrates with his first place ribbon dose under the water in his seabed.
Remember beta blockers by the beta fish sitting on her throne of blocks. This class of medications ends in the olal suffix, shown by the lolly being fed to the heart. Beta blockers work in three ways. First, by decreasing heart rate and contractility, shown by the down arrow heart timer and flexing. Second, by decreasing peripheral vascular resistance, the down arrow peripheral vessel resistance band. And third, by decreasing renin release, the down arrow wrench being released by the heart. Common indications for this medication include hypertension, the hiker BP, heart failure, the dead heart, and angina pectoris, the angel with pectorals. However, it is important to remember that beta blockers are contraindicated in asthma and heart block patients, shown by the caution tape, asthma inhaler, and heart block. Nursing considerations involve assessing the blood pressure and heart rate prior to administration, depicted by the assessing BP cuff and heart timer. This medication may mask signs of hypoglycemia, shown by the masked hippo glue bottle, and should not be abruptly stopped, the can't stop cold turkey. So let's review beta blockers. Remembered by the olal suffix, work by decreasing heart rate and contractility, decreasing peripheral vascular resistance, and decreasing renin release. This class of medications may be used in the treatment of hypertension, heart failure, and angina pectoris. However, they are contraindicated in asthma and heart block patients. Nursing considerations include assessing the blood pressure and heart rate prior to administration, being aware that signs of hypoglycemia may be masked, and to not abruptly stop taking this medication.
This beta fish rules over her minions from atop her blocks, which were stacked over many years of hard labor to form a sort of temple to the gods. Now that the heart has completed the temple, the beta fish rewards it with a lollipop. Its heart timer immediately drops and its flexing muscles relax. The tight resistance band around its peripheral vessels loosens then falls, allowing blood to flow more freely. And with the temple finished, the heart doesn't need to hold on to its wrench anymore, so the down arrow wrench is released. With the temple finished, the beta fish releases the hiker BP from its job of hiking blocks up to the top. Sadly though, one heart died while construction was still underway. But the gods were pleased with his work on the temple. So the clouds part, and an angel with massive pecs emerges, helping the dead heart ascend to heaven. Asthma inhalers and hearts with blocks aren't allowed at the temple for good reason. As the inhaler climbs the caution tape, it strains and lets off a little toot. What would normally be a harmless little fart actually goes on to loosen one of the blocks, and it falls, landing right on the heart below, blocking its electrical conduction. The temple is a treasure trove for archaeologists, who assess the BP cuff and heart timer hieroglyphs. Unfortunately, temples are also easy targets for tomb raiders, and a masked hippo glue bottle opens a secret entrance to raid the valuables within. But instead of gold or jewels, the only thing in this tomb is a cold turkey, which escapes despite the masked hippo's best efforts not to leave empty-handed. Rookie, every tomb raider knows you can't stop a cold turkey.
Dobutamine is shown in this picmonic as Do Buddha, who is an all-seeing spiritual leader. This medication is a beta-1 agonist, the beta fish Wan dragonist who sought help from the Buddha, complaining that the eye heart flexing was causing problems in his village, representing that this medication is an inotropic agent. Dobutamine is indicated for use in patients with heart failure, the dead heart who dies after Buddha smites him. Side effects of treatment include tachycardia, the tac heart card, whose effigy serves as a reminder to be kind to your neighbors. Arrhythmias can also occur, the broken arrhythmia drum who was spiritually awakened as he learned of Do Buddha's powers. Considerations for patients on dobutamine, which is given by continuous IV infusion, is to closely monitor patients for cardiac developments like tachycardia and hypertension, shown by the monitor close to the patient as they both also learned of the Buddha's power. It should also be noted that other medications can increase the potency of dobutamine, like MAOIs and TCAs, and this is shown by the med bottles praying and worshipping so hard that an up arrow pot increased Buddha's powers. So in summary, dobutamine is a beta-1 agonist which has inotropic activity on the heart. It is used in patients with heart failure and can lead to the side effects of tachycardia and arrhythmias. Considerations for your treatment include closely monitoring patients and knowing that other medications can increase dobutamine's potency.
Hoo-hoo! Nothing says Zen like Do Buddha's muffin. As the Do Buddha, I see all and know all. Because of my spiritual powers, people from all over come to seek my help and guidance. A beta fish dragoness with a 1-1 came to me because an evil monster was destroying and pillaging his village. It was a mean old eye heart flexing, so I used my spiritual powers to kill that heart dead. Then we tacked the heart to a card to let everyone know we don't take kindly to pillagers around here. Woohoo! The tack sounded the broken arrhythmia drum, and others like the monitor and patient were spiritually awakened as they learned of my powers. They taught the med bottles my ways, and they started worshiping me too. As they prayed, my powers grew and grew like an up arrow pot, thus making me the all-powerful Do Buddha you see today. Hoo!
Digoxin, which has the trade name Lenoxin, can be remembered by the digital ox running wild, terrorizing the town before finally being wrangled up. This drug works by increasing the force of heart contraction, or increasing inotropy, the up arrow eye heart flexing, who is grabbing the ox by the horns. The ox is chasing the dead heart because digoxin is indicated for heart failure, along with atrial fibrillation, the atria heart alarm clock used to attract the ox. A side effect of this medication is bradycardia, the snail heart who is coming out of hiding, while the sleepy guy leaning against a wall represents fatigue, another side effect, which may present with headache and malaise. Caution tape around the heart with block is shown because this drug is contraindicated in patients with heart block, where it can lead to lethal consequences. It has a very narrow therapeutic index and causes various drug interactions. Make sure to check the patient's pulse and withhold the medication if the patient's heart rate is below 60, the heart timer less than 60. Never give this drug to patients who have hypokalemia, the hippo banana who was run over, as this may exacerbate signs side effect. Thus, you should monitor for toxicity, the toxic ooze knocked over by the ox, which includes yellow, green visual changes. Digibind, the digital ox bound by the cowboy, is the antidote for digoxin toxicity. Let's review. Digoxin works by increasing heart entropy and is indicated for heart failure and atrial fibrillation. It leads to the side effects of bradycardia and fatigue. It's contraindicated in patients with heart block, and it should be noted to check for a heart rate below 60, hypokalemia, and toxicity after treatment. Its antidote is Digibind.
Digoxin is like the running of the bulls, but with a digital ox instead. It goes stampeding through the streets, chasing nearly dead hearts, who dare to taunt the ox with fibrillating atria heart alarm clocks, on red capes, like bullfighters. This forces the hearts to take the ox by the horns, or die. The heart loves itself, so it puts on an I Heart t-shirt, maybe a couple sizes too small, and rips through it with increased flexing muscles. While the heart goes on flexing with increased force to wrestle the ox, everyone else is worn out from being chased by the ox. A fatigued guy is leaning against a wall, having barely survived, and a snail heart is slow to come out of hiding. The ox left a path of destruction, which included a banana stand, where a hippo was buried by falling bananas. The hearts with blocks weren't allowed to participate because they couldn't risk more conductivity issues, so they had to remain outside the caution tape. But they still came to see lots of action, though, so they point to this speed limit sign and say they don't want to see anything lower than 60 BPM. After the digital ox ran into a bunch of toxic barrels and spilled ooze into the city, causing vision changes, the wranglers stepped in, and the digital ox was bound by a lone cowboy.
Acute digoxin toxicity is portrayed by the acute-angled digital ox with a toxic green glow. Adverse reactions to digoxin are relatively common due to a narrow therapeutic index. Acute digoxin toxicity can cause hyperkalemia due to paralysis of the NAK-ATPase pump shown by the hiker bananas. On the other hand, chronic digoxin toxicity can be more difficult to diagnose as it can cause hypokalemia and more neurologic symptoms. Other acute adverse effects include cholinergic symptoms like nausea, vomiting, and diarrhea, shown by cholinergic colican, vomiting, and the toilet. In addition, it can lead to disturbance of color vision, including mostly yellow and green and a halo of light, shown by the yellow and green halo. Acute digoxin toxicity can also cause arrhythmias, portrayed by the broken arrhythmia drum. More specifically, it can cause bradycardia, which means a slow heart rate shown by the slow snail heart. These effects on the heart cause EKG changes, like PR interval prolongation, which is specifically associated with digoxin toxicity and is portrayed by the prolonged or stretched PR Prada purse. Another EKG finding to remember is decreased QT interval, shown by the QT heart on the ground with a down arrow. Further EKG manifestations can include scooping, portrayed here by the large ice cream scoop, and T-wave inversion, portrayed by inverted Mr. T. So remember, adverse reactions to digoxin are relatively common due to a narrow therapeutic index. Common adverse effects include hyperkalemia, cholinergic symptoms, blurry yellow and green vision with halo of lights, arrhythmia, and bradycardia. Acute digoxin toxicity can also cause EKG changes, such as PR interval prolongation, decreased QT interval, scooping, and T-wave inversion.
On hot summer days, the digital ox sells ice cream along the sandy beach. All the beachgoers knows he's open for business when he pops open the lid to his ice cream cart to an acute angle. But today, something's wrong. Today, the digital ox's ice cream had become toxic. Bananas were the culprit. Too many bananas. See, the hiker banana pumped an overload of the stuff into the ice cream, turning the ox's treat from potassi yum to potassi yuck. People began getting sick. Try as they might to wash it down with cola, they couldn't help but vomit and use the toilet. So sick, this poor woman's eyes turned yellow and green. She thought for sure she'd be an angel in heaven. She could already see the yellow and green halo forming above her head. But then she hears a rumble. It was not only her heart pounding, but also the pounding of a broken arrhythmia drum. Her heart was pounding loudly, but slowly as well. Just as slow as the snail heart slipping by her. But wait, this sneaky snail is taking advantage of the situation. He snags her Parada purse and stretches it to his level. In that purse, he sees QT heart candy. He throws it down to the sand and says, "See that ice cream scoop? That's what got you into this mess. All these sugary treats will get you sick, lady. Ice cream, cola, and QT hearts? That's enough to turn Mr. T upside down. You have to beware of Digital Ox's toxic ice cream."
Remember nitroglycerin by your trip to the Nitro Glacier. This medication works by decreasing preload, shown by the down arrow preload heart pump, which is stuck as it's being frozen by the nitro. Common indications for this medication include angina, shown by the angel with chest pain. With angina, the patient can have up to 3 doses separated by 5 minutes between each dose, shown by the 3 doses of Q clock with 5-hand. Side effects may include headache, the head egg lump, or hypotension, shown by the HiPoBP. It is important to remember that nitroglycerin is contraindicated in patients also taking Viagra, also known as sildenafil, shown by the caution tape around Hugh Hefner. So be sure to ask the patient about Viagra use before administering this medication. Additionally, this medication should not be given if the patient has a low BP, so be sure to assess blood pressure prior to administration, shown by the man assessing the hippo's blood pressure. Other nursing considerations include protecting this medication from light, shown by the shield protecting the medication from the sun, and using a glass bottle and special tubing when administering intravenously. Lastly, always wear gloves for applying topically, shown by the gloves on Hugh topically applying medication. So let's review. Nitroglycerin works by decreasing preload in patients experiencing angina. A max of 3 doses may be given separated by 5 minutes between each dose. Common side effects include headache and hypotension, and this medication is contraindicated in patients taking Viagra. Be sure to assess the blood pressure prior to administering this medication and protect it from light. Use the glass bottle and special tubing for IV administration, and wear gloves for topical administration.
The Nitro Glacier is a hidden retreat where angels go to relieve their chest pain. It accomplishes this by freezing the preload heart pump, preventing it from filling the heart so much. This can be done with up to 3 doses, 1 every 5 minutes, as provided by the 3 doses Q clock with a 5-hand. Unfortunately, due to climate change, this beautiful glacier is melting, and giant chunks of ice fall away all the time. These massive ice chunks land on the indigenous creatures, like the HiPoBP, causing huge headache lumps. When Hugh Hefner learned of this icy oasis where beautiful angels go to rest, he just couldn't resist paying them a visit. But as soon as the old creeper showed up, he was wrapped in caution tape and forbidden from going near the angels or the glacier. When the scientists learned of the glacial melting, they came to help. Now they struggle to save the hippos by assessing their blood pressure. And they do everything they can to protect the glacier and its medicine from the sun, using shade from a glorious shield. For the time being, this preserves the medicine in the glass bottle and special tubing. But with so much shade, what lies within the light is all the more noticeable. And old Heffy is caught red-handed trying to apply the medication topically to one of the angels. Well, he's caught glove-handed anyways. Hands off, Hefner.
Statins, portrayed as the statue being decorated by the rabbit throwing a party, are cholesterol-lowering drugs commonly used to prevent hyperlipidemia in conditions like stroke and myocardial infarction. Adverse effects can include rhabdomyolysis, the rabbit with muscle and lights, which is the breakdown of muscle cells, and hepatotoxicity, the liver that is covered in the toxic green chemical. The mechanism of action of statins involves inhibiting the enzyme HMG-CoA reductase, a rate-limiting enzyme in the cholesterol synthesis pathway, represented by the HMG hummingbird coin purse and the red duck locked up inside the cage. Statins benefit patients by decreasing LDL cholesterol, the ladybug devil with the down arrow, and decreasing triglycerides, the triceratops with a tag and down arrow. Statins also increase the good cholesterol HDL, portrayed as the hot dog angel with an up arrow on the top of the image. These effects can help prevent atherosclerosis and conditions like stroke or heart attack. So, in summary, statins are cholesterol-lowering drugs that can prevent stroke and myocardial infarction. Adverse effects can include rhabdomyolysis and hepatotoxicity. Statins work by inhibiting the enzyme HMG-CoA reductase. This results in decreased LDL cholesterol, decreased triglycerides, and increased HDL.
This statue is being decorated by the rabbit's muscle lights for a party. His liver has a toxic green glow after the last one. He trapped dinner in a cage by using a coin-A purse for bait. Now, there's a hummingbird fighting for a coin-A purse with a red duck. They'll complement each other nicely on the dinner plate. The ladybug devil will never know. She's banned from this party. She and her lame tag triceratops are downers, and this statue only kicks it with party people. There are enough hot dog angels for everyone, with more on the way, ensuring that this will be a night to remember.
Bile acid resins, the bile-Nile acid lemon raisins, are a class of drug which work by disrupting the enterohepatic circulation of bile. These drugs work to decrease cholesterol and are indicated for hyperlipidemia, shown by the hiker with lips. The mechanism by which they exert their action is by binding to bile and preventing bile acid reabsorption in the gut, illustrated by the acidic lemon being prevented from being reabsorbed by the sponge. These medications cause increased cellular uptake of LDL to process more bile, decreasing LDL cholesterol, shown by the down arrow ladybug devil. Commonly used bile acid resins are cholestyramine, shown by the Cole stapler, cholestyramine, Cole-star man, and cholestyramine, the Cole servant. A side effect of treatment with these drugs is GI distress, the GI with flare gun, and cholesterol gallstones, cholesterol burgers with gold stones, which occurs due to increased cholesterol concentration in bile. Bile acid resins also lead to decreased absorption of fat-soluble vitamins, shown by the down arrow bacon Viking ship. So to review, bile acid resins are used to treat hyperlipidemia by preventing bile acid reabsorption in the gut and decreases LDL levels. The three agents available include cholestyramine, cholestyramine, and cholestyramine. Common side effects include GI distress, the development of cholesterol gallstones, and decreased absorption of fat-soluble vitamins.
The bile-Nile is being taken over by acidic lemon-stealing raisins because they want to use the land for their new coal mining business. And these pesky raisins are annihilating everything that gets in their way. First, they take out the original landowner, Hiker Lips, known for using his puckering lips as a lemon farmer. But he doesn't go down that easy. He tries to throw a lemon at the new coal mine to ruin them. However, a raisin grabs it and binds to it before it can be absorbed by the mine sponge. And to ensure that the hiker will stay down, the raisins attack with a down arrow ladybug devil. At the mine, things are going according to plan. The coal stapler is installing the sponge, which is being operated by the Coal-star man. And the coal servant? Well, he serves the raisins by washing the coal in the bile-Nile, which causes some nasty side effects for the other inhabitants of the river. The dirty coal pollutes the waters and makes it hard for GI to do his job, which is panning for gold. And so he gets so upset that he shoots off a flare gun. Why? Because the polluted water contaminated his gold stones with greasy cholesterol.
Fibrates, represented by the flybrats, are lipid-lowering agents indicated in patients with hyperlipidemia, hiker with lips. These drugs work by upregulating LPL, shown by the upregulated lip laser, and increasing lipoprotein's lipolysis activity and ability to bind to triglyceride-rich lipoprotein. This increase in lipoprotein lipolysis leads to a decrease in triglycerides, depicted by the down arrow tag triceratops. Fibrates are also mildly effective in causing a slight increase in HDL, illustrated by the small up arrow hot dog angel, due to stimulation of reverse cholesterol transport. Fibrate treatment forms LDL with a higher affinity for its receptor, leading to more rapid catabolism. Thus, these drugs lead to a slight decrease in LDL, depicted by the small down arrow ladybug. Side effects of these medications include hepatotoxicity, portrayed by the liver with a toxic green glow, and cholesterol gallstones, shown as cholesterol burger goldstones.
From the newest line of brats, meet the fly brats. They're no ordinary brats. They'll keep anyone from invading your picnic, like those pesky hikers with totally overdone lips. Ugh, so 5 minutes ago. How do they do it? They've got their shimmering up-regulator lip laser, sure to bring down any pesky tag triceratops. Sparkle, shine. And as a free bonus, you'll get the hottest new hot dog angel, now in a miniature size. And they'll bring down any ladybugs in the blink of an eye. Wanna enjoy your delicious picnic meals worry-free? Bring in the fly brats and you can chow down on your yummy toxic green liver and cholesterol burger with goldstones anytime. Fly brats each sold separately, batteries not included. Fly brats forever!
Use this picmonic to remember atorvastatin, also known by the trade name Lipitor, as the image of the A-tofu statue. Medications in this class end with the suffix statin, shown by the statue. Atorvastatin is an HMG-CoA reductase inhibitor, shown by the hummingbird coin-A purse with red duck and inhibiting chains. HMG-CoA reductase inhibitors are effective at decreasing low-density lipoproteins, LDL, and total cholesterol levels. Therefore, they are indicated for use in those with high cholesterol, shown by the high cholesterol burger. Side effects include hepatotoxicity, the liver with toxic green glow. Thus, patients taking statin medications should be monitored for jaundice and increased liver function tests. They may also develop a rash, shown by the rash on the piece of tofu. Another more severe problem is rhabdomyolysis, the rabbi muscle with lights. This occurs if myopathy persists, shown by the Mayo Party hat, which is injury to the muscle tissue, leading to symptoms such as diffuse or local muscle aches, weakness, and tenderness. If this side effect occurs, serum creatinine kinase, CK levels will be increased. Because statins may cause liver damage, it's important to monitor liver enzymes before starting this medication, and as needed for signs of liver damage. The liver produces the majority of cholesterol at nighttime. For this reason, it's recommended that statins are administered at bedtime, shown by the guy eating in bed. Lastly, remember to educate to avoid grapefruits and their juice if taking a statin, because grapefruit contains chemicals that inhibit CYP3A4, causing levels of the statin to increase. So, in short, atorvastatin is a part of a class of drugs ending in the statin suffix, which are HMG-CoA reductase inhibitors indicated in the treatment of high cholesterol. Side effects may include hepatotoxicity, the development of a rash, rhabdomyolysis, and myopathy. Therefore, it's recommended that liver enzymes be monitored frequently to assess for toxicity. HMG-CoA reductase inhibitors should be taken at bedtime, and grapefruit juice should be avoided.
A tofu statue stands in front of every atorvastatin tofu stand. They're like the McDonald's of tofu. And every McDonald's has a Ronald out front, just like this place has a tofu statue. All the employees are dressed up like little statues, and they're super passionate about any food with low cholesterol, like tofu, which has 0. Unlike the other fast food joint next door, where they used to sell greasy hummingbird burgers. I say used to because everyone eats tofu now, so the koine purse of the Red Duck is running low on coins, and he's closing for good. Putting high-cholesterol burger joints out of business is something every atorvastatin tofu stand sets out to do. The statue can even be seen holding a cholesterol-filled burger up high and crushing it like the weak little excuse for nourishment it is. While the food here is more healthy than hummingbird, this tofu stand has some dirty secrets of its own. They fry the tofu cubes using a liver, but the cooking oil is making it toxic. The tofu is fully cooked when it turns bright red with a rash, and it's blessed by a rabbi for anyone who only eats kosher tofu. What they don't tell you is he has to bless so many cubes, his muscle lights are breaking down. And the secret sauce that everyone loves slathering on their tofu so much is really just mayonnaise with a party hat. And it causes muscle problems as well. Wherever one of these tofu stands pops up, it's not too long before the toxic green runoff from the liver is flowing down the gutters of the streets, with little liver enzymes munching on everything they come across. Still, the people love their tofu, and they even eat it in bed. Of course, the other health foods like grapefruit get a little jealous and have to be locked up. They just don't play well with tofu. Ba-da-ba-ba-ba! It's mediocre at best.
Vitamin B3 is illustrated by the Viking bee climbing up into a 3 tree to play in the nice sun, which represents niacin. Vitamin B3, Viking bee in 3 tree, niacin, nice sun. It is also known as nicotinic acid, which plays a role as both a vitamin and a medicine. Clinically, niacin interferes with triglyceride production in the liver, causing decreases in triglyceride levels, the down arrow triceratops, decreases in LDL or low-density lipoproteins, the down arrow ladybug devil, and increases in HDL, or high-density lipoproteins, the up arrow hot dog angel. Thus, niacin can be used to treat high cholesterol or dyslipidemia, shown by the disc lips. It can also be used to treat niacin deficiency, also called pellagra, shown by the pelican. Patients with pellagra may experience diarrhea, the toilet, dermatitis, the dermatologist examining a rash, and dementia, the demented D-man. In high doses, nicotinic acid can cause vasodilation, leading to flushing, shown by the flashlight to flush skin as the sun's rays beat down. This side effect can be prevented by taking aspirin beforehand. The GI shoots his flare gun in distress, representing GI distress as another side effect. But worst of all, the rays also cause toxic damage to the land's crops, turning them into a liver with toxic green glow, representing hepatotoxicity as another possible adverse effect. So in summary, vitamin B3 or niacin works to decrease triglycerides and low-density lipoproteins or LDL, while also increasing high-density lipoproteins, HDL. Niacin can be used to treat dyslipidemia and pellagra, which is associated with symptoms such as diarrhea, dermatitis, and dementia. Side effects include flushing, GI distress, and hepatotoxicity.
The land is dry and arid, with no food or water. So the Viking bee climbs up a 3 tree to pray to the nice sun. He says, "O great sun, we are overrun by predators and pests that are killing our livestock and crops. Can you please help us?" And the sun replies by shoving the predator, Triceratops, down a cliff. And then he finds the pests that were eating their crops, the ladybug devil, and he tosses it down the cliff as well. Without the beasts or the pests, the land was plentiful yet again. And everyone rejoiced and ate up-arrow hot dog angels. The natives wore big discs in their lips to show their gratitude towards the sun. Even a pelican began to visit the land, as it now flowed with water from a toilet, giving life to all. Everything was great, that is until a dermatologist noticed a rash on the demented D-man. "What gave you this rash?" he asked. And the man just pointed at the sun. "Oh no, the sun is beginning to be too nice!" And shining his light down harsher than ever. "Stop it, sun, that's nice enough!" But the sun did not relent. His rays shined down like a flashlight to flush skin and scorched everything in its path. G.I. shot his flare gun into the air in distress and cried for help. But worst of all, the rays caused a toxic damage to the land's crops, turning them into a liver and toxic green glow. So the land was yet again left dry, arid, with no food or water. And so the Viking bee climbed up the tree again, to pray to the nice sun. But then it dawned on him, and he was burnt as well.